Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Erica Dorn. She's a nurse practitioner. Today's Kevin MD article is ChatGPT in healthcare, risks, benefits, and safer options. Erica, welcome back to the show.
Thank you for having me.
All right, so tell us what your latest article is about.
Yes, so I specialize in helping nurse practitioners implement charting and time management tips so that they can get their chart notes written faster and they can just create a better work-life balance and stop charting at home. And so one of the newer charting tips, a topic that is very popular, is using AI to help you write chart notes. And I know I've heard a lot of providers talk about using ChatGPT, if it's a good option, how it can help them. And so I just wanted to talk today about some of the benefits, but then also some things that providers should really pay attention to, some of those cons, things that they should be aware of.
All right, so yeah, AI scribes, that's really exploding in terms of that intersection between AI and healthcare. There are a lot of competing AI scribe companies that are out there, and it's almost like the Wild West, right? Eventually, there's going to be consolidation, there's going to be winners, there's going to be losers. So, from the nurse practitioner standpoint, tell us the type of questions that you're being asked about regarding that intersection between AI and what they do in the exam room.
Yeah, so as far as utilizing ChatGPT, I mean, I get asked a lot if that's a safe option, if it's HIPAA compliant, if it, includes the clinical practice guidelines, if it will replace our critical thinking skills. And so as far as using ChatGPT, those are some of the questions that I get asked. As far as using AI medical scribes, I get asked some of those similar questions, how does it work? Is it safe to use? What will it actually do for my chart note? How will it actually help me? And if it's a good option to help save time.
All right, so let's talk about ChatGPT and let's expand that to other commercial large language models like Google Gemini, Anthropic's Claude. So, how about in general for these commercial large language models? Do they have a role in healthcare?
I think they do. And, we've seen AI in healthcare just explode over the past few months. We're utilizing the AI in a lot of different ways, from EKG interpretation, from helping us, with radiology interpretation, helping with drug manufacturing and, analyzing all the data and everything. And then also we've seen it in the hospital use too, to pick up on some of those early cues to figure out, the how the patient is tracking, if any kind of complications are coming about. And so that's how we've already seen AI in healthcare. And I do feel like AI has a part as far as the charting. So one thing that a lot of providers are wondering, how can I save time charting? Can I utilize these tools to help me improve my charting and just to make it flow a lot easier? And so I've heard of a lot of providers wanting to utilize ChatGPT to help them write better notes and get them signed faster.
So, specifically when it comes to HIPAA compliance and patient privacy concerns, tell us about some of the issues regarding these commercial models like ChatGPT.
So, ChatGPT is not HIPAA compliant. So, I strongly encourage providers not to utilize it from, adding patient specific information. For example, I've heard of some providers, copying and pasting their transcript from their visit with the patient into ChatGPT and then say, summarize this and create a SOAP note for me. And I strongly discourage providers doing that. The ChatGPT is not HIPAA compliant. And so we need to be very, very careful with our patient's personal information.
So, some people would wonder what ChatGPT does with that information. You say that it's not HIPAA compliant. So, what happens if we do put sensitive patient information into that ChatGPT model? What's some of the worst case scenarios that can happen?
I mean, the information we put into ChatGPT goes out into the World Wide Web. And so it would be so unfortunate if there was a breach of that patient confidentiality and, if their information was spread throughout. I mean, that's the really big thing that clinicians need to be aware of when using ChatGPT.
Okay, so let's talk about ambient AI scribes. Like you said, your specialty is to help nurse practitioners be more efficient and decrease that charting time. So, What have you seen in terms of the efficacy when it comes to these ambient AI models? Do they really work and do they really save time?
Yeah, I have seen them work and save clinicians a ton of time. One of the differences between ChatGPT and AI medical scribes is like the actual production of the note. So, ChatGPT, you can always ask it, what is a questions, review of systems that I need to go over with the patient when they come in for abdominal pain. But with AI medical scribes, it is doing that work as far as pulling the information from your visit. So
Mhm.
the AI technology listens to the patient and the provider, and then it can abstract the important information that needs to go in the chart note and essentially write your chart note for you. So I think the big kind of difference is the time that you are spending, using ChatGPT. You have to put in those prompts. You have to ask it to create a comprehensive neurological exam. You have to ask ChatGPT how to create a template for a procedure. If you're doing like a laceration repair, you can ask ChatGPT how to write that.
Mhm.
And that can be helpful, that can help you save some time. But essentially, the AI medical scribe is picking up on that information that is said. A lot of them you can create your own templates. So you can create like quick phrases, smart phrases, I mean, similar to those dot phrases,
Mhm.
and have that information already in there. And then the AI medical scribe goes in and changes anything specific to the patient. So that's kind of the really big difference in how I think AI medical scribes are better than using ChatGPT, just because it's doing that next step for
Mhm.
you. It's, you know, HIPAA compliant, it's writing your chart note for you. Whereas with ChatGPT, you have to insert those prompts in order for it to produce the information.
And in general, how much time have you seen being saved documenting the exam room? Just give some ballpark contrasting numbers.
I would say an average of like 3 to 5 minutes per patient. So, if you're seeing 20, 30 patients a day, that's a substantial amount that you can save by using an AI medical scribe. And the other tip that I share is signing chart notes off right after you see the patient visit. That way, the information is clear in your mind. You don't have to, at the end of the day, try to recall what signs and symptoms the patient had. And so that's just another way that, even if it doesn't necessarily save you a whole lot of time, it's helping with your overall mental clarity. You don't have that mental fatigue. You can move on to the next task without feeling bombarded by all of these open, unsigned charts that you still have to address. So, just another tip that using AI medical scribes, it writes the chart note right after you see the patient. You can copy, paste it into your template. A lot of the AI medical scribes are integrated into the EHR. And then I always recommend that providers review that chart note. Obviously, you're signing it,
Mhm.
you will be held liable. And so that's just one way that AI medical scribes can help you stay caught up, help you stay consistent, and help you sign those chart notes faster.
How customizable is the output that the AI medical scribes come up with? One of the questions I often get asked is that the AI scribe doesn't sound like me. It may not write like me. So how customizable is that output?
It depends on the AI medical scribe that you are using, but a lot of them are just growing in their technology. So a lot of them you can create charting templates. You can have, if you have a normal physical exam that you like to use, you can insert that so it sounds more like you. And then, as I was saying, the AI picks up on the information that's abnormal and can change that. So the templates are very customizable. A lot of them also learn your preferences. So the AI technology can pick up on anything that you go and edit and, then ask the AI to learn that format. And so then for the next charting note, it picks up on that. For example, I was using an AI medical scribe and it was producing the chart notes in very long form sentences. And
Mhm.
I like to use, short phrases in my charting. And so when I changed that and asked the AI to learn that format for the next notes that it created, it made them in short phrases. So that's just one way that the technology is getting there, that it will sound more like us. There's the templates, the things we can do to insert our charting preferences, how we sound. And so it will sound more like a provider and less like a computer.
I said earlier that it's a little bit of the Wild West when it comes to AI scribes. There's many, many different companies trying to gain a foothold in this space. And eventually, I think some are going to be successful and some may be bought out. Are there any major differences, as far as you know, between the various brands of AI scribes?
So the biggest difference right now is the EHR integration versus an independent, website or app where you have to copy the note and then paste it into your EHR. I do agree. I think we will move towards the EHR integration, and I think all the major EHR companies will have that AI medical scribe component. Those are the basic ones. I've also seen pricing is, fairly good, across the board as far as there's the differences, EHR integration versus independent. There's some new features like the customizable templates. There are ICD codes and, helping like with your billing and coding component. There are some other differences as far as writing a excuse like a work release
Hmm.
excuse or a referral letter. Like I've seen some of the AI medical scribes offer that, other ones don't, but it seems like they're all catching up to each other very quickly. So if you find an AI medical scribe company that you like, it's very likely they will make these updates within the next several months just to try to stay up with the other AI medical scribes.
Now, we've spent a lot of time talking about AI medical scribes, but there are a lot of other areas that AI is influencing what we do in healthcare. So, what are some other examples that AI is being used in the exam room that your nurse practitioners are telling you that they're using AI? What are some other ways?
Yeah, alluded to this a little bit at the beginning, but with EKG interpretation, with radiology interpretation, I think those are helpful ways that we will see the AI. And then patient monitoring will be a big one as far as, in the hospital setting, can it pick up on those early cues that a patient's condition is going to deteriorate? Also, we'll see a lot more, outpatient based, just with some of the limitations of access to healthcare. I think AI will be a very strong component. And then we've already seen the analyzation of data with
Hmm.
these, drug companies doing their research, and they just save so much time by using AI to help them analyze that data.
And what do you see coming up in the foreseeable future? I know that this field is so rapidly evolving. What do you see in the foreseeable future that we could expect from AI in healthcare?
I mean, I cannot predict the future, and I think we will continue to see new technologies coming abroad. I don't know that I know any, specifics that we'll be seeing in our clinical practice, but I just want to encourage providers to accept AI. I know it still feels a little scary, a lot of unknowns, and there are some limitations, but I do agree that AI will be used in healthcare in very many different aspects. And so I think becoming familiar with it, becoming comfortable with it, utilizing the AI technology that we do have, and then, being aware of what's coming as well. I think that's going to set clinicians apart from other clinicians. If you go for a job interview and they ask you about your feelings of AI, or, maybe they're using an AI technology in their practice setting and you're not comfortable with that, that might limit your job opportunities. And so I think it's something that we need to be cognizant of. I think we need to be aware. We need to embrace it
Mhm.
and, just learn all the ways that AI can help us in healthcare.
Have you talked to some of your nurse practitioner colleagues who tried an AI scribe and decided for whatever reason it wasn't for them and went back to the way they originally documented, like dictating? Have you had any of those cases?
I have had a few, and I think, some people just get stuck in their ways. They don't want to learn a new technology. Maybe it feels overwhelming to use it at first. If you're used to dictating your notes or, typing them out, I mean, that's fine to do. I have just seen the impact of AI medical scribes and how much time it can save me in my own practice, but then also my other nurse practitioner followers. So, again, it's something to learn about, to discover, to try for yourself. A lot of these AI medical scribes offer a free trial. So it's something you can give a try in your own practice. And then, if it doesn't work, that's fine. But I just strongly encourage providers to give it a try.
So I know that they're being used a lot in the outpatient setting, like the one I'm familiar with. How about inside the hospital in inpatient settings?
Yeah, so the big one is the patient monitoring. And a lot of this is, picking up on vital signs, on, physical exam, physical cues to help keep our patients safe. And so I don't know like specific the companies or anything that are in the hospital, but I know we've already seen so many different technologies, different ways we can use AI. And again, it will just continue to explode and be able to help us as providers.
In terms of clinical documentation, as far as you know, are AI scribes being used for documentation in an inpatient setting?
I don't know for sure. I mean, I have heard of a few inpatient nurse practitioners that have tried. I feel like it may be a little bit more difficult unless, it's something that you're seeing that patient for the first time. You can definitely use AI medical scribes to help you get that information in the chart note. As far as your, daily roundings, progress notes, you could always, utilize that technology. It's a little bit harder because when you're in the hospital setting, you're
Mhm.
usually, rounding on one patient. You've already looked over their labs. You might get some phone calls or interruptions from nursing in between there. So it's a little bit harder to open the AI medical scribe, start your visit and not get any of those
Mhm.
distractions. So I think it's something that will continue to evolve and grow.
We're talking to Erica Dorn. She's a nurse practitioner, and today's Kevin MD article is ChatGPT in Healthcare: Risks, Benefits, and Safer Options. Erica, let's have some take home messages that you want to leave with the Kevin MD audience.
Yeah, again, I just strongly encourage providers to give AI medical scribes or, the AI technology a try. Again, it's going to be vast in healthcare. It's going to help us in so many ways. So I just encourage you to learn about it, to embrace it, and to give it a try.
Erica, thank you so much again for sharing your perspective and insight, and thanks again for coming back on the show.
Thanks for having me.